Welcome to today's special Halloween edition of Facebook Live Q&A with experts from the UVM Children's Hospital. I'm Alex Tercey with the UVM Health Network. Halloween is, of course, coming up on Saturday, and it's traditionally a spooky time of year. This year, in the midst of COVID-19 and the pandemic that we are in, it might be truly scary for some members of our community. According to the CDC, traditional Halloween activities like trick-or-treating, trunk-or-treating, parades, parties, group gatherings are all considered high risk for COVID-19. We're here today to talk about the risks as well as safety precautions you and your family can take and safe Halloween activities with Dr. Benjamin Lee and Dr. William Raska, both pediatric infectious disease physicians with the UVM Children's Hospital. Thanks for joining us today, doctors.
Our pleasure.
Thank you.
If you have a question for Dr. Raska and Dr. Lee, please leave it as a comment below and we'll make sure that we answer it live on air. If we don't get to your question for whatever reason, please rest assured that we will make sure that we answer it after the live. So first question, does the risk asserted by the CDC apply to local communities and why?
So the risk asserted by the CDC does apply to our local communities. No matter where you are in the world, we know that there are certain activities that carry a higher risk for infection with COVID-19. And the themes are universal. The activities that are higher risk are large gatherings, particularly indoor gatherings, and activities that involve a lot of close or face-to-face contact. So whether it's in the context of Halloween, or any other extracurricular or recreational activity, any activity that brings people in close contact, particularly indoors, is going to be higher risk, whether you're in Vermont or anywhere else. Here in Vermont, we've been successful for so long at keeping the amount of virus low because as a community, we've been quite good at heeding the advice of our leaders and doing the things that limit risk, such as avoiding congregating in large groups, avoiding large indoor activities, physically distancing and wearing masks. And the same principles apply for Halloween. Right now, I will say there has been a noticeable increase in the number of cases we've seen in Vermont recently. So as the weather gets cold and the virus actually gains a bit of an advantage, we really need to make sure that we remain vigilant and continue to heed that guidance and follow the rules for limiting the spread of COVID-19.
I mean, I can imagine it's hard for children, to understand that Halloween will be different this year. And of course, something they always look forward to, trick-or-treating, getting candy, being with friends. How can parents help their children understand, how and why Halloween would be different this year?
Alex, I think families have had this discussion for quite some time, that since March, families have had to discuss themselves why things are so different. Schools shut down in March. Activities across Vermont shut down, and parents had to explain why their children couldn't go out and play with other children. And if we think about school reopening, that we've had to do it quite differently. Across Vermont, some schools are fully remote, some are hybrid, some are in person, and there are all kinds of procedures in place to minimize the risk of transmission of this virus in that setting. So I think families and parents and children have had a lot of discussions about this, and the Halloween is part of that discussion, and that it is some activities, just as Dr. Lee said, are riskier than others. And that if we want to do Halloween celebrations, then we need to figure out ways to do them safely. Just like schools had to figure out ways to make school safe, we need to make whatever activities we do with Halloween, follow the guidelines and minimize the risk of transmission. But I think parents and children have had lots of these discussions already, and they'll continue to come for other holidays, particularly Thanksgiving and winter religious holidays.
Sure. Are there certain ways that you advise that families could celebrate safely this year or differently this year that might be safer options for them? Any suggestions?
Yeah, so there's a variety of different things that one could do that would be safer. So these would be things like rather than traditional trick-or-treating, perhaps doing slightly more controlled, smaller activities within the family. So these would be things like maybe outdoor, scavenger hunts for candy, These could be, things where families could plan to do an indoor movie night or Halloween themed, TV or TV shows, that sort of thing. The things that we really need to try to be very cautious about are the ones where we're gathering lots of people together indoors. So a large party where you're inviting the whole neighborhood, that really would be a bad idea. But smaller activities, preferably limited to within families or outdoors with reasonable spacing, those would all be certainly reasonable to consider.
So you hear of some communities, they're hosting, for example, Halloween parades, an outdoor activity. What is your advice if to somebody who might be participating in something like that?
So go ahead, Lee. Go ahead, Ben.
Yeah. So the advice is the same as we would give for other scenarios. If it's outdoors, the risk is less. Make sure everybody is at a good physical distance of at least 6 feet. And make sure everybody is wearing a mask. Those really are the most important principles. So recently we've had some of our colleagues have come up with a very nifty little saying to help folks remember. So 6 foot spaces, masks on faces, avoid crowded places. And whether it's a parade, whether it's trick-or-treating, whether it's a scavenger hunt, as long as folks are trying to adhere to those principles, that will reduce the risk of catching or spreading COVID-19.
I like that. Nice little rhyme there. So that's 6 foot spaces, masks on faces, uncrowded places. That's a good one for everyone to remember.
And I would just add that when we say masks on faces for Halloween, it's not simply a Halloween costume mask.
I was going to ask about that.
It still needs to be a facial cloth covering, or if it's a Halloween mask, it has to have that built into it.
Okay. All right. Fair enough. If you're just tuning in, we're talking about Halloween during COVID-19 with Dr. Benjamin Lee and Dr. William Raska. They're both pediatric infectious disease physicians at the UVM Children's Hospital. If you do have a question for the doctors, please leave it as a comment below and we'll answer it live on the air. So you took my question about the Halloween masks. Next question.
Sorry.
No, don't worry, you answered it. So now everyone knows that Halloween costume masks are not enough. You have to make sure that they meet the protocol for masks. My next question is if children or families are going to be around others outside of their immediate household, and maybe this is the rhyme that you just said, what precautions should we use? I guess it's the same, the 6 foot spaces, masks on faces, uncrowded places.
We just want people to be able to do this safely. And as long as you can physically distance and have a facial cloth covering on, then we can figure out ways to do this. But again, as Dr. Lee said, when you have these large gatherings, particularly indoors, that is just such a risky environment. We're just so cautious about that. So again, if you're going to mix households together, that outdoors is safer than indoors. Please follow the distancing. Please wear the mask. And that we have noticed over the past 9 months, and whenever there's been a holiday, there's been an outbreak of COVID shortly after. Now, Halloween's not a nationally recognized holiday, but it's an important gathering time. People get together. You have Halloween costume parties. It's all good stuff, and kids want to get together. But we just know that all those activities, so it was after Memorial Day, after July 4th, after Labor Day. So, and now because it's much colder, it's going to be more likely that people are going to be indoors than outdoors. There's just a lot of concern. So I hear the kids, oh my gosh, I love trick-or-treating. It was a hoot. It was so much fun. I had all my jokes lined up, but, and they're terrible. They're still bad. But, it was fun to be with my friends and we take our kids out. But we just implore people to be safe. We really.
Yeah.
And for folks and families who do decide that they would like to hand out candy or go trick or treating, there are ways that could be done more safely as well. So one popular idea that's gotten a lot of attention in the media is using candy chutes, like a big pipe that lets you slide candy down to a waiting kid at the other end that would provide some distance between you and the trick-or-treater. Another idea is to hang candy from a clothesline, for example, or spread candy out on a table so that people can come and retrieve candy, but doing so in a way where the kids are spaced out. I think all of these would require a little bit of hands-on supervision just to make sure that people are sort of keeping a steady and reasonable flow, and it doesn't end up being a big mob scene at the door. But there are ways that we can try to minimize the risk if the decision is that that families would like to let their kids trick or treat, or at least try to trick or treat to the extent that they can.
So, Dr. Lee, how would you feel if a child carried a fishing net around with them and stretched it out? Could they put it into the net rather than?
Well, so it's funny you mentioned that, because in my own family, so I have two young kids, and one of the discussions we're having, nothing has been finalized yet, but if they do trick or treat, and there are a number of houses near us that we think we trust the families, and we've been talking about doing this. I may send them out with butterfly nets so that if they do come across a house where there hasn't been a plan put in place already for how to pass out candy at distance, then they can distance themselves by just holding out a net. So there are creative ways to try to do this. And I think my kids are at the age where I think they would get a lot of fun out of that too. So that's one idea that we are percolating as well.
Yeah, I was just going to say, I think it's all about making it fun for kids in a different way. I know I have a 4-year-old daughter, and we're doing a scavenger hunt because she loves that kind of thing anyhow. And to her, it just seems like a fun, interesting thing that we're going to do. It doesn't seem like, woe is me, the trick or treating. So I think it's all in the presentation. I love all those ideas you just shared. And I saw Shelby had a question about that. So Shelby, I hope we answered your question. Let's see, is there another question that came through? Let's see here. Yes, Shelby says, looks like Dr. Lee read my mind. So good. Question about, the older kids, so teens who might be a bit more headstrong, want to celebrate with their friends. How can parents, what advice do you have for parents of teens who might be dealing with that?
So that's, Alex, as you know, a hot issue these days. It turns out that a lot of the transmission in the United States recently has been really generated by young adults, not 13 and 14, but that people are trying to get out and be with their friends. I would ask that these teens be leaders in the community. The young teens actually are doing a really good job in a lot of aspects. And when I go to, some of the middle schools and other places, they've done a good job masking. Be a leader, just show everyone that you can do this. As you know, Alex, if you just say, don't do this, I would say there are ways to do it. Let's look at the strengths. You have great friends. You want to be able to continue to see those friends in a variety of formats. You want to be able to see them at school. You want to be able to see them on the soccer field. And if we don't do this together, we won't be able to see them in those places. So be a leader. I know you can do it. You have been doing it. You have been terrific. It's the reason why we have a low rate of COVID, and keep up the good work. Let's do it.
I love that.
Emphasize strength-based, they're intrinsically great kids.
Wonderful. Thank you. Any final message to the community about Halloween?
So I think the final message that I'd like to leave folks with is, not to sound like a broken record, but it's such a critical time right now. Weather's turning colder. More things by necessity are going to have to be done indoors. And so the best thing we can do right now is to be as vigilant as possible at doing the things that we know reduces the risk of spreading COVID-19 or catching COVID-19. So that's no large gatherings, no indoor gatherings, and that everybody should remember to mask and practice physical distancing in whatever setting, whatever context. Those are the important things to keep in mind. At the same time, Halloween should be fun. So we're not trying to say we need to take the fun away from the kids, but there are ways that we can do this and still do it in as safe of a manner as possible. And as Dr. Raska mentioned, Vermont as a whole has been doing so extraordinarily well It's been a long slog already, but let's keep up the good work and continue to do our state proud.
So I want to just say two things, Alex. One, for the question in the chat box, but I agree with what Ben said, is that, but everything's different. Everything is different in the pandemic, and Halloween's different, but it doesn't mean it's not going to be fun. We can make it fun. We have to put in some certain parameters around it, but we can make it a great experience, just a slightly different great experience. As for the question about spreading it from house to house, the likelihood of transmitting the virus on a piece of candy, picking it up from one house to another house, is really, really, really low. You need to wash down the candy individually and everything else like that. I think that generally speaking, we wash our hands before we begin the activity. We wash our hands at the end of the activity, but each individual piece does not need to be washed. And you're not going to take the virus from the house on the first house on the street to the second house on the street.
Thank you so much, Dr. Lee and Dr. Raska, for making time for this and to talk to our community. If you do have a question, but you didn't get a chance to ask it, or you watch this after the fact, please post it as a comment below and we'll make sure that we ask the doctors about it. And remember that poem, 6 Foot Spaces, Masks on Faces, Uncrowded Places. And of course, remember that here at the UVM Children's Hospital, at the UVM Health Network overall, we are open. We are here for you. If you have questions about your care, call your doctor about your care or your family's care. So thank you all for joining us, and we'll talk to you all soon. Thanks for joining Facebook Live.
Happy
Thanks a lot. Bye-bye.
Happy Halloween.